Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with nursing student Gina Peter. And today we're going to talk about a big problem since the start of the pandemic, mental health.
Our guest today is Dr. Prakash Masand, a psychiatrist who is the founder of Centers of Psychiatric Excellence and an adjunct professor at the Academic Medicine Education Institute at Duke National University of Singapore Medical School. In fact, he has developed specific therapies and trained therapists around the world to work with patients during pandemics like COVID.
So, Dr. Masand, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you so much. Delighted to be with you, Dr. Jeanine, and with Gina.
So first of all, I hope you're doing well. And can you tell us how might you have been personally affected by COVID-19?
Yeah, thank you so much. Me and my family are doing well, fortunately. But as you know, everybody's lives have been affected by COVID, either directly or indirectly, and mine is no exception. It's been a difficult time for everybody around the world because of the limitations that the pandemic has put on people's ability to socially interact, to work, to go to school. And that has been quite difficult for everyone, for some people more than others. And then, of course, all of us probably know someone who was affected by COVID, and the same is true for me. I had a colleague from med school who contracted COVID, who was working as an anesthesiologist in New Jersey and actually died from the illness.
Wow.
And so, all of us have been affected in one way or the other.
Oh, I'm sorry. So what made you want to become a psychiatrist? Can you tell us a little bit about your professional career?
Sure. So interestingly enough, when I first started and I was in med school, I wanted to be a cardiologist. And then when I did my rotations in psychiatry during my third year of med school, I really enjoyed my clerkship in psychiatry. I had some wonderful mentors. And that's what changed my mind and made me go into psychiatry. And I haven't regretted it at all. It's a wonderful specialty to be in.
So we hear about the physical complications of COVID. Tell us a little bit about your professional career and how it takes a mental toll on people too.
Absolutely. There's no question. And in fact, I argue that for most of the country, the psychological consequences of COVID are probably worse than the physical consequences of COVID. Obviously, for the people who've lost their lives because of the illness, that's a separate issue. But for the millions and hundreds of millions of people around the world, the psychological consequences have been quite tremendous. There is loneliness, there is anxiety, there is depression, unhealthy eating behavior, substance abuse, opioid overdoses. It's been really tough for individuals, for healthcare workers on the front line, and for everyone else.
So can you tell me, with that said, are you seeing it affecting more the young population or the older population or the middle age? Who is mostly affected by this mentally?
So I would say it's affected the population across a broad range of age groups in different ways. So the elderly, as you can imagine, because of the isolation that they've had to be in, either in nursing homes or in their own individual homes, because they are a very vulnerable group to COVID-19, loneliness has had a really deleterious impact, particularly on the older population. In the younger population, the lack of social interaction has been quite problematic. Younger individuals, we are a very socially interactive society, particularly in the US, but I would say all around the world. And the younger generation, whether it's the millennials or Gen Z and other generations, they love the interaction. They love being out with their friends, going out, grabbing a bite, going to the theater, going to the movies. And not being able to do that has been quite devastating for that patient population.
So are you seeing many patients now with mental health issues that are related more to COVID?
So there are two groups of people. There are people who have a history of psychiatric illness. So they've already had a history of depression in the past or anxiety in the past. And the COVID-19 pandemic has exacerbated their underlying illness. And then there is a separate group of people who had no psychiatric illnesses to begin with, but they've been adversely affected by the COVID-19 pandemic and developed an anxiety disorder or depression or another psychiatric disorder.
So I can imagine that even whether you were affected by COVID-19 or know someone who's affected or not affected at all, the social isolation has an impact upon how we are mentally and how we can stay healthy in this very trying time, if you will. So the patients that you're seeing now, how are you able to discern whether the mental ailment, if you will, or mental issues are relevant to COVID, or is it relevant to maybe something more pathological or something more in their history? How do you make that differentiation?
So obviously the best way to make that differentiation is to get a good history from the patient. And when you speak to the patient, you can discern what the contribution of the pandemic has had directly or indirectly on their mental status or their mental health, and whether this is merely an exacerbation of an underlying illness and that COVID plays a minor role, or in some instances it plays a major role. So really a good history is what enables you to discern that.
Okay, so how does someone know if what they're experiencing with their mental health is something that's minor and would pass, or whether they need to come and seek professional help?
That's an excellent question. All of us in our lives, occasionally, maybe once a month, once every 2 months, may feel a little down, may feel a little anxious in response to what's going on in our lives, and that's normal. And so even with the COVID-19 pandemic, feeling anxious or losing a night of sleep or feeling a little bit down is normal. How you distinguish between what's normal and something that is deserving of more of an intervention is the frequency of that mental state. So if you feel anxious every day for a week, 2 weeks in a row, if you feel depressed every day for a week or 2 weeks in a row, that's not normal. If the depression or the anxiety interferes with your functioning to a significant degree, in other words, you're unable to do your schoolwork, or you're unable to interact with your friends or colleagues, your family members, or do the job that you're doing virtually, then it indicates that something needs to be done about it. So really, it's the frequency and the impairment that determines what the intervention should be.
Now, tell me, I'm hearing a lot of violence kind of manifestations, particularly in the news. I understand the depression and the anxiety, but how does violence play a role in COVID-19?
So if you think about human behavior, each of us as individuals have unique coping styles, right? So if you have 10 friends and you said, oh, how does Anne respond when she gets stressed versus Gina versus Prakash versus Jeanine? And each one of us has a very unique style of responding to stress, right? Mm-hmm. And some people, unfortunately, have a style of responding to stress when they externalize and they project it outwards, right? They engage in behaviors that you and I may consider to be societally unacceptable or things that we discourage. So when you think about it in that context, all you got to think is, if somebody is stressed, what's the path of least resistance as to how they respond to stress? And then you begin to understand why certain individuals may respond to the COVID-19 pandemic by indulging in violence or rioting, and other people may respond to it by isolating themselves, not speaking to their friends and families, not returning any phone calls, not being able to do their schoolwork or their work at their workplace, et cetera, et cetera. So it's really a question of resiliency and a question of your personality, your temperament, and your coping style.
So this pandemic, it really has had profound impact on how the world has responded emotionally. And I'm wondering, your education, the psychiatric community, particularly physicians, have you been able to go into the community to teach? I'm thinking the judicial system and police, that may see these violence acts and possibly look at what would be quote unquote a criminal, relating these feelings and emotions more to the result of COVID rather the result of just violence in and of itself, if you will.
Sure. And as you know, there are many organizations whose charter or mandate is to do exactly what you said, right? To identify psychological problems, psychological stressors in populations, maybe ones that have been arrested or incarcerated, and find out ways in which they can be dealt with other than by incarcerating them for long periods of time. So there are organizations that do that. We don't. That's not our mandate. We don't do that at any of the COPE centers. But there are organizations who do that. And it's excellent to address that. Mm-hmm. But at the same time, I think it's important, for your listeners to know that each one of us does have control over our own behavior, right? Mm-hmm. It's not like we are beasts who have no control over our behavior, that, there's a part of the brain called the frontal lobe, and humans have a very big frontal lobe because we have what we call a conscience or a superego. And when we want to do bad things, your brain says, you cannot do that. It's actually not a nice thing to do. And your mother will be unhappy, or your spouse will be unhappy, or your sister will be unhappy, or the cops will be, somebody's going to be unhappy. So don't do it. It's not a good thing to do, right? But unfortunately, there are some people whose frontal lobe is not as strong, is not as, their conscience is not as strict as other people may be, and then that's when the problem arises, right? So it's a little bit difficult to blame human behavior on any single event or any single stressor, because we are very complex human beings. And what we do or what we say or how we interact is a function of so many different things.
It is. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, along with Nassau Community College nursing student Gina Peter. And today we're talking about mental health during the pandemic with Dr. Prakash Masand, a psychiatrist who is the founder of the Centers for Psychiatric Excellence and an adjunct professor at the Academic Medical Education Institute at Duke National University of Singapore Medical School. And Gina has a question for you now.
So you developed a therapy to help people cope with emotional side effects of COVID, one that incorporates the benefits of ACT therapy combined with mindfulness-based stress reduction, resiliency training, and crisis counseling. Can you talk a little bit about this?
Sure. So first, I should acknowledge that the therapy was created by one of my colleagues at Duke, Christine Tew. So she's one of the therapists at Duke in Durham, North Carolina. And Christine works with us at COPE. And Christine came up with this 6-session psychotherapy based on the principles that you just enunciated, which is ACT and mindfulness-based resiliency training and relaxation training. So essentially, as you can imagine, when we have psychological effects of any stressor in our life, whether it be an important event, a loss, or an external event like the COVID-19 pandemic, it affects our thinking and it affects our behavior. And when we see a therapist for psychotherapy, we work with them essentially to see how we can change our thinking or change our behavior so that it's as close to normal as possible and is not distressing us by the unpleasant thoughts or the unpleasant behaviors. And so ACT, which is acceptance and commitment therapy, is a type of psychotherapy where you try to address the cognitive inflexibility that occurs in individuals in response to stress. And there are techniques that the therapist has at their disposal to help you deal with the thoughts and the behaviors that are a consequence of that cognitive inflexibility. So, for example, when we speak about acceptance and commitment therapy, rather than saying to the individual, these thoughts are terrible, you need to get rid of them, like we may do in cognitive behavior therapy, here you say, okay, you have the thoughts, let's accept the thoughts, but let's put it in the proper context. So once we begin to put it in the proper context, then the psychological consequences of those distressing thoughts are different. And the behaviors that occur in response to those distressing thoughts is different. So acceptance and commitment therapy is just one type of psychotherapy that can be helpful for individuals who have psychological consequences of COVID-19. And so we use the principles of ACT and resiliency-based mental training to develop the 6-session therapy, which we offer to our patients at our COPE centers. And then we also train therapists around the country. Christine Q does the training where we teach them how to do the therapy in their centers. So that way it's like train the trainer. And so we train therapists, in different parts of the country and different parts of the world, so they can then apply these same principles in their practice.
Do you have these centers in New York?
So we have 5 centers currently in the US. One is in New York City in Manhattan. One is in Charlotte, North Carolina. One is in Philadelphia. One is in Houston, Texas. And one is in St. Louis, Missouri. So those are the 5 COPE centers that we currently have.
Well, you said that your centers are in New York. The therapists who are running these sessions, are they all psychiatrists, or are they also nurse practitioners and physician's assistants? Who
Correct.
are the therapists?
So the therapists primarily are either social workers or psychologists who do the therapy. In some instances, it may be a nurse practitioner or a psychiatrist, but by and large, the psychiatrists and the nurse practitioners in our centers are involved in providing medication management, and then we have therapists in our centers who do the therapy.
So how long is the training period for your professionals who work with this ACT program?
So basically, we offer weekly training sessions, and individuals who are interested in learning about the therapy log on, and it's conducted on Zoom. And Christine goes through the principles and gives them homework assignments and reading material that they have to do in addition to the sessions. And then they can log in every week and they can even discuss the patients that they've been treating with the therapy and the issues that have arisen. So it's kind of an ongoing dialogue that occurs on a weekly basis with teaching them about the therapy and using case-based learning to also teach them about the therapy, in addition to Christine providing them with background material and reading material and homework assignments.
Can this occur via Zoom, or does it have to be in office?
No, so we actually have been conducting all our training on Zoom.
Oh, wow.
So this has all been on Zoom that we do the training.
How do you feel, in your opinion, therapy and training via Zoom versus in person? Is it the same effectiveness, or do you?
So it's a little bit difficult to generalize it because there are several factors that go into the effectiveness of the therapy, right? So one is the therapist's level of comfort with the technology platform and doing virtual therapy. And then also the type of patients that you're treating. Some patients benefit from in-person, in the office therapy. Other patients do wonderfully well with virtual therapy using a Zoom platform or another platform, particularly if the therapist is well trained in virtual therapy and is able to use the platform in a way that's very conducive, then the results can be the same.
If I didn't want to come to ACT, or I didn't have a need or felt like I needed to or could improve from the benefits of ACT, are there any kind of simpler ways that I can address mental anxiety or this kind of anxiety I feel when I hear the news and the rise in COVID cases? I mean, just listening to the news, I can tell you it's very anxiety producing. What can I do?
Right. So one of the nice things that COPE has done is we've developed a free app. And the app is available on the Apple Store, iTunes Store, and also on the Android Google Store. And the app is called COPE Wellness. So COPE Wellness. And you can download it for free. And the app actually allows you to initially do a quick screen of your symptoms of depression, anxiety, insomnia, substance use. And then there are self-management tools in the app, which are relaxation training, tension relieving exercises, meditation, distraction, which you can do. And the app takes you through a weekly schedule of the self-management tools that you can benefit from.
So say that again, COPE, and the last part of COPE?
Wellness.
Oh, wellness. Okay.
Yeah. So it's just COPE in all uppercase, and then the word wellness. So if you just type in COPE Wellness in the iTunes Store, the App Store, or the Google Android App Store, it'll show up.
Would you suggest, and this sounds really funny, but would you suggest turning off the TV? And turning off some of this news?
That's an excellent question. And I always tell my patients that you have to limit your exposure to anxiety-provoking events in your life, right? So you don't need to watch the news 24/7. You don't need to listen to the radio 24/7, be on Facebook 24/7, be on Instagram or Twitter 24/7. You should limit the amount of exposure to these platforms to maybe twice a day, maybe 20 minutes in the morning, 20 minutes in the evening. And if there are certain platforms that are particularly anxiety provoking, I would just avoid them. So there's no question that we are bombarded with overwhelming sequencing of events and anxiety provoking commentary and op-eds on how our lives are ruined or going to be ruined. And for some people, that's terrible. They don't know what to do with that information. So you have to limit it. You also have to compartmentalize things. So you cannot take one event and generalize it to your entire life. You should be able to compartmentalize it to its particular bucket or its particular room. And so make sure that if something happens at work, you cannot let it affect your social life or your interactions with your family, right? You should be able to compartmentalize it and say, this was a work-related event, and I'm going to deal with it in a manner that's consistent with what it was. So that's very, very important. So limit your exposure to the hype, compartmentalize events that occur. And then, we've developed a very nice acronym to help people cope with the psychological consequences. And the acronym is the word CARE, C-A-R-E. C is connections. Establish connections with your friends, your family, your colleagues. Maybe you do a Zoom call, a virtual book club, a virtual wine tasting, a Zoom call with family members in different parts of the world that you may not have been in contact with before, on Skype, on Google Meet, whatever it is. So that's C. A, attitude. Have a positive attitude. It's very easy to look at an event and generalize it and think that this is the end of the world. Nothing is the end of the world. The world has not ended for millions and billions of years, and it's not going to end in the next billion years. So attitude is very important. Have a positive attitude. Everything will come to an end. Every terrible event in the world has a finite end. And COVID-19 will also have an end, hopefully with the availability of a vaccine. Then R, reach out and help someone. Studies have found when you help other people, maybe helping a neighbor to get their groceries, maybe donating to your favorite charity, maybe helping at a food bank, whatever it is, reach out and help someone. It's found that altruism is a very good medicine for anxiety and depression. It actually decreases your anxiety and decreases your depression. So reach out and help someone. And then E, exercise. I always tell people 30 minutes of exercise, whatever you like, Peloton bike, yoga, meditation, a walk in the park, go for a bike ride, whatever form of exercise, elliptical, I don't care. Just doing that 4 to 5 times a week, it's a very powerful antidepressant and anxiolytic. I always tell people the cheapest antidepressant in the world is exercise. It's free. You don't even have to pay for it.
So, we've made steps in addressing the stigma around mental health, but still there are some people that struggle to address it. Do you have any words of encouragement for them?
So I think it's very important to conceptualize mental illness as any other illness that human beings can get. The only difference is the organ that's affected is the brain. So I always tell my patients, do you have a family member with heart disease? Do you have a family member with diabetes? Do you have a family member with high blood pressure or kidney disease? And they go, of course, Dr. Masand. My father has hypertension. My mother has diabetes. My cousin has arthritis. And I go, psychiatric illness is no different. It's an illness of the brain. The symptoms are different. The treatments are different. But it's no different than any other medical illness in the world. The causes are the same. Some of it is genetic, some of it is environmental, and some of it is psychological. Nobody can ever deny that you can get high blood pressure. It can be contributed to by leading a very stressful life if you have the genetic underpinnings and you're overweight, right? Nobody can deny that at all. So the same is true for depression or anxiety. Some people have a genetic predisposition. Some people have environmental stressors that are quite problematic in their life, losses, etc. Other people, maybe they abuse substances, they drink alcohol or do recreational drugs that may be responsible for it. So the contributions can be different, but the causation is the same as for every other physical illness we know.
So if one of our friends listening wanted to get in touch with you for more information about questions they may have, how can they get in touch with you? What is your website for people to get more information?
Our website is called copepsychiatry.com. So COPE psychiatry. So copepsychiatry, one word.com.
Well, thank you for being here, Dr. Prakash Masand, a psychiatrist who's founder of the Centers of Psychiatric Excellence and an adjunct professor at the Academic Medicine Education Institute at Duke National University of Singapore Medical School. We hope you stay safe and continue to do the great work you do.
Thank you very much.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with nursing student Gina Peter. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to WHPC@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.